This is Dr. Jacob Teitelbaum and part 7 of the Human Energy Crisis, Reproductive Hormones. We'll find that many of us, when we hit our 40s and certainly by early 50s, are starting to see drops in our reproductive hormone. These include estrogen and progesterone for women and testosterone for both men and women. The blood tests do not show abnormalities or deficiency until one is a good 12 years into perimenopause. And again, the symptoms will hit before the cessation of menses. How do you tell if you might need bioidentical prescription reproductive hormones? If you find your symptoms of headache, fatigue, and insomnia are worse around your menses and you're over 42, you may be in perimenopause. If you have erectile dysfunction, loss of libido, in men, if the testosterone level is under 500, I consider treatment.